Hi, my name is Jamie McAnally with Pediatric Surgical Associates. The purpose of this video is to help you understand your child's incontinence. We will discuss 6 topics: bladder function, bowel habits, behavior basics, the 5 C's, bladder relaxation medications, and avoiding journal. When you first visit Pediatric Surgical Associates, you will receive a Care Clinic folder or Continence and Restoration of Elimination that summarizes the key points in this video. Let's talk about our first topic, bladder function. Urination is the result of a coordinated relationship between 2 important muscles. The first muscle lies on top of the bladder, and when it contracts, the bladder empties. The second muscle is the sphincter muscle, and it must relax in order for the urine to empty effectively. When the bladder is relaxed, it stretches, storing urine until it reaches capacity. The urethral sphincter stays contracted to hold urine in the bladder until it is full. There are 4 key causes that trigger a child to wet their pants: an overactive or unstable bladder, some people refer to these as bladder spasms, infrequent voiding, incomplete emptying of urine, and abnormal anatomy. If your child makes frequent trips to the restroom or is always running urgently to the restroom, this occurs because the bladder squeezes to empty prematurely, which is a symptom of an overactive bladder. They may also potty dance or posture before using the bathroom. It is also common for children to intentionally overhold urine to continue an activity which may result in the child wetting their pants. Some children also have the inability to fully relax their sphincter during urination, which could be associated with constipation or bladder hyperactivity. In these situations, children can develop an overcontraction of the urinary and anal sphincters. Then, when it is time to urinate, the urinary sphincter is so tight that the child has difficulty relaxing enough to allow it to open and produce a normal stream, thereby causing problems with complete bladder emptying. Your child's anatomy could also be a factor to cause their incontinence, and if this is the case, we will discuss this further with you in clinic. Constipation is one of the main causes of incontinence in children. There are 2 reasons for this. Rectal fullness or distension can put a direct pressure on the bladder, causing bladder irritability and urgency of urination. The second reason is that the anal and urethral sphincters are coordinated, and if the anal sphincter is overcontracted to hold a full bowel, the urethral sphincter can be overcontracted. This can make it difficult for your child to fully relax the sphincter and empty their bladder effectively. There are several ways to treat constipation. A high-fiber diet helps to give bulk to the stool to help push it through the colon. In your folder, you will find a list of high-fiber foods. We will let you know how much fiber your child needs on a daily basis. As great as fiber is to help fight constipation, drinking fluids is just as important to keep the stool soft so it can be pushed through the colon. We recommend regular intake of fluid or water throughout the day. Rather than focusing on the number of ounces that your child drinks throughout the day, we recommend paying attention to the color of their urine. If you notice that your child's urine is yellow, that is a signal that they need to drink more water. The goal is for your child to drink enough fluid so that your child's urine is nearly colorless. The body has a natural reflex that helps to pass a bowel movement after meals. Your child should also have a stool to rest their feet on, which puts their body in a natural evacuation position. You should also avoid excessive dairy intake, no more than 20 ounces of milk per day. The type of milk that you choose can also be constipating. We recommend skim milk. There are also some medications that we can recommend to manage and prevent constipation for your child. Miralax is our drug of choice to manage most children's constipation. The medication is odorless, tasteless, and clear when dissolved in liquid. It is recommended to mix vigorously with water. If we feel that this is the medication to treat your child's constipation, we will discuss this in more detail, including the frequency and dosage at your clinic visit. If your child has severe constipation, we will also discuss a bowel cleanout. It should be strongly enforced that your child urinates at least every 2 to 3 hours and whenever the urge arises. The frequency that your child uses the bathroom is the first step in achieving healthy bladder function. They must avoid overholding. If someone is not available to help remind your child to urinate on a time-voiding schedule, there are products available, and if you are interested in hearing more about these products, we can discuss it in clinic. The toilet should not be treated as a quick stop. After your child thinks they have emptied their bladder, we recommend singing the ABCs or a nursery rhyme twice to ensure that their bladder has had enough time to fully empty. For females, the way we sit on the toilet is important. We recommend pulling their clothing down well below their knees when sitting on the toilet and leaning slightly forward while keeping their knees hip-width apart. It is also important to avoid certain foods that trigger bladder spasms, which can lead to incontinence. We call these the 5 C's: caffeine, carbonation, chocolate, citrus, and excessive vitamin C. Some children may also need a medication to help reduce bladder spasms, which will then decrease urgency and episodes of wetting. We will only prescribe these medications if we are 100% certain that your child is not constipated, because these medications will only make constipation worse. We will discuss these medications with you, if appropriate, at your child's appointment. It's very important to keep a journal of your child's voiding and stooling habits. This is a great way to get your child involved in the process, and by keeping track, you may be surprised at their actual toileting habits. Please bring a copy of this to discuss with your provider at your appointment. For more information on incontinence and bowel movement issues, please talk to your nurse practitioner while in clinic.